The publication from Gia et al. That was published in Medical Science Monitor is about a study with recurrent implantation failure patient that was performed in China, and then they compare what was the effect on the clinical outcome when ERA was applied by the personalization of the embryo transfer. This was compared with a group of patients also with recurrent implantation failure but without using ERA disease, performing the standard embryo transfer. This study was performed just in one clinic with 281 patients. 140 were in the group of the ERA and 141 were in the group without ERA. The results of this study show that implantation rate, pregnancy rate, and clinical pregnancy rate were statistically significantly higher, around double, in the group in which ERA was performed when compared with the group without ERA. This study is very relevant because all the patients in both groups had recurrent implantation failure, but in the group in which ERA was applied, it was possible to increase significantly their reproductive outcome. This meta-analysis analyzed separately good prognosis patients from 0 to 2 previous failure attempts and recurrent implantation failure patients with 3 or more previous failure attempts. The result show that when we compare good prognosis patients with and without ERA, there are no significant difference, but there is a trend observed in which the group with ERA has a higher live birth rate and ongoing pregnancy rate. However, when studying the recurrent implantation failure group, they compare patients with a standard window of implantation, disease that result receptive with IRA, and patients with a displaced window of implantation. In both groups, it was performed the personalization of the embryo transfer, and there were no difference between them. However, it is very relevant that when comparing the clinical outcome obtained in this recurrent implantation failure patients group, in which ERA was applied in all of them, versus good prognosis patients, the clinical outcome, meaning as live birth rate and ongoing pregnancy rate, was similar. So this study, this meta-analysis, is showing us that by applying ERA in recurrent implantation failure patients, we can increase their outcome to good prognosis patients.